Hi, everybody. Today I am here to answer the question that caregivers are asking. What does failure to thrive mean for elderly parents? Elderly parents who experience ongoing health declines may be formally diagnosed by a doctor with what's called adult failure to thrive. It's AFTT. And it's a term used by the healthcare system, which doesn't make a lot of sense to caregivers or older adults. But what it really means is that the physical body is weak and it's failing for a number of reasons. I'm going to give an explanation of what this adult failure to thrive is and what you can do about it. I'm Pamela D. Wilson. My website is PamelaDWilson.com. On there, a lot of hope, help, support for caregivers and aging adults. Please press the share button on this video. Follow me on my YouTube channel so that other people who are caregivers and aging adults can find this information. If you are a caregiver, you may automatically think that getting old brings on a lot of health problems. And it can, but it always doesn't necessarily have to be that way. It does bring on health problems if there was a lack of education or knowledge throughout life about what we need to do to stay healthy, not only today when we're 20, 30, 40, 50, or 60, but stay healthy into our 70s, 80s, 90s, and maybe even 100. So let's talk about adult failure to thrive. A simple way to look at it is to look at the health diagnosis of your elderly parents. Maybe they just have one health issue like high blood pressure, or maybe they have 5 or 6. Then look at how their mind is functioning up here. So do they have a little bit of memory loss? Are they forgetful? Are they just sharp as a tack? Then look at their physical abilities. What can they do every day and what do they do every day? Do they exercise? Do they walk? Do they mostly sit in a chair all day? Are they tired? Are they exhausted? So all of those combined contribute to this idea of failure to thrive. And so if there are concerns about any one of these conditions, or if these conditions are all kind of like coming together, then your parent may be in a state of failure to thrive that hasn't been diagnosed by a doctor. So the first thing to do is really go to a doctor, talk about all these issues that you're seeing, and ask about, what does failure to thrive mean, doc? Is my parent in this state? Because really what that can mean is, if nothing is done, they can continue in this downward spiral of health declines where they continue to get worse and worse and worse and worse. And you as a caregiver are providing more and more care. It's almost as if they are kind of on that road to end of life. But in many situations, you may be able to, if it has not gone too far, to help them maintain their health or make it even a little better. So it's possible to manage a failure to thrive situation. However, there are going to be situations where if you haven't seen your parents in a while, or you live 2,000 miles away and you haven't visited and they've been sick for a long time, it really may be to the point where there's not going to be a lot that you can do to reverse this condition. And so at that point, there are other discussions to have about palliative care or hospice care so that your parents can be as comfortable as possible and avoid unnecessary treatments or unnecessary hospitalizations that are only going to make them worse. And then there are other times when, if it hasn't gone too far, you may be able to identify some things that you can do. If a parent has 5 or 6 health diagnoses, you may not know which one actually is causing the most problems, but there are simple things that caregivers can do. So things like improving the nutrition of an elderly parent. Nutrition is a contributor to failure to thrive. It's a contributor to a low immune system response where your parents get sick and they maybe improve a little bit, but they continue to get sick, and it's kind of this back and forth issue of ongoing health problems. Their physical abilities, their sleep, their medications that they take. There's a lot of things that you can look at, but taking a step back from all of this, one of the most important questions you can ask is, what does your parent want? What does your spouse want? We as caregivers assume that, well, mom or dad are going to want to get better, or they're going to want all of this extra treatment and extra care. And maybe they really don't. Maybe your mom or dad just wants to be comfortable and they don't want a lot of fuss, and they're okay knowing that their time is coming. On the other hand, like I talked about, a lot of family caregivers, because you're attached to your parents or your spouse, you want them to be with you. You don't want them to die. You want to do as much as you can and you want them to have treatment, but it really isn't what they want. So it's important to talk about that. Then it's also important to acknowledge our fears about death, about having a loved one pass away. It can be frightening, especially if you've never had the experience before. And truly, it's something that a lot of us don't even want to think or talk about because it's unpleasant and it's scary to think that one day this person that we love is not going to be with us. So use the time long before loved ones near the end of their lives or arrive at a failure to thrive situation to talk about end of life plans and what everybody wants. Because there's so many practicalities. If you are a spousal caregiver and you're the healthy one taking care of a sick spouse, you're going to go on living. How are you going to do that? What is your plan? If you're an adult child who has a lot of time invested into caring for aging parents, how are you going to go on? How is your life going to change? Life goes on after our loved ones pass away. Consider how you as the caregiver are going to go on and talk about that. And most of all, as you go through this process, think about your own end of life. What do you want? What kind of care do you want? Do you want extensive care? Who's going to be your caregiver? How are you going to pay for care? Talk about those things today and put those plans in place so that you will have peace of mind about what you want and the decisions that will have to be made. And you can talk to your children or your spouse or your family about it so that this isn't a discussion that you are delaying until a year before you're passing or 6 months before you're passing, or even worse, 2 weeks, 4 weeks before you're passing. I'm Pamela D. Wilson. My website is PamelaDWilson.com. On there is a lot of hope, help, and support for caregivers and aging adults to talk about many of these emotional and difficult topics. Please share this video with other people that you know who are caregivers or aging adults looking for hope, help, and support. I'll see you all again soon in another video.